Hey there, I'm Sophia, and I'm going to walk you through how to inject Menopur into your muscle or intramuscularly. This method helps the medication absorb into the bloodstream more quickly. These instructions are broken up into 5 quick steps. Let's start by making sure you've got all your supplies ready to go. Depending on your dose, a vial or more of Menopur. Each vial should contain powder or a pellet, a vial of sterile diluent, a syringe, a Q-cap for mixing, an injection needle, plus alcohol pads, a gauze pad or cotton square, a sharps container, and a clean surface. You may get prescriptions or supplies that use cc or ml interchangeably. Don't worry. They're just different names for the same amount of volume. For example, 1 cc is equal to 1 ml. Also, check to make sure the diluent is clear and doesn't have any particles floating around. If you see anything, don't use it and call your healthcare provider right away for next steps. Now, go ahead and wash your hands really well with soap and water. First, you're going to mix the diluent with the powdered Menopur. Start by removing the caps from both vials and wiping the tops of each with an alcohol swab. Then, peel open the Q-cap pack. You're going to want to keep it in the package for the next step. Just be sure not to touch the spiky part. Next, place the diluent on a flat surface and hold the sides of the vial. With your other hand, turn the Q-cap pack over and place the open part on top of the vial. Push the spiked end straight down through the rubber stopper and into the vial until it snaps into place. If the Q-cap falls out of its package, toss it and use a new one. Once the Q-cap is securely in place, go ahead and remove its packaging and toss it in the trash. Be careful not to touch the connector end of the Q-cap. Next, you'll draw air into the syringe. So pull back the plunger to the amount of diluent your healthcare provider has recommended, usually 1 cc or 1 ml. Place the tip of the syringe into the connector end of the Q-cap and twist clockwise until it's tight. Gently press the plunger all the way in, which pushes the air into the vial and makes the diluent easier to withdraw. Without removing the Q-cap, turn the vial upside down and slowly pull back the plunger to withdraw the recommended amount of diluent. Then, go ahead and turn the vial right side up and pull on the syringe barrel to remove both the syringe and Q-cap from the vial as one unit. Just be careful not to pull on the plunger during this step. Next, place the vial of Menopur powder on a flat surface. Take the syringe you just prepared and slowly insert the spiked end of the Q-cap through the rubber stopper and into the vial until it snaps in place once again. Then slowly press the plunger to inject the diluent into the vial. Without removing the Q-cap, gently swirl the vial to allow the powder to dissolve. Then push the plunger down to remove any extra air that's in the syringe. You'll want to use the solution right after mixing. Without removing the Q-cap, turn the vial upside down and slowly pull back the plunger to withdraw all of the liquid. Be careful not to pull the plunger out of the syringe barrel. If your dose is more than 1 vial, use the syringe you just prepared to mix up to 5 more Menopur vials. There's no need to add more diluent. If you have any questions, call your healthcare provider. Once everything is mixed, twist the syringe to remove it from the Q-cap. Toss the Q-cap and vial into the sharps container. Then remove the wrapper from the injection needle. Twist the needle onto the syringe and then remove the needle cap. To get rid of any air bubbles, point the needle up and gently pull back on the plunger or tap or flick the syringe until the bubbles rise to the top. Then press the plunger slightly until a tiny droplet of medication appears at the tip of the needle. A droplet is a good thing. It means your medication is ready to go. Recap the injection needle and set it aside. Now you're ready to move on to preparing your injection area. Okay, so there are a few places where you can inject your medication into the muscle. For today, I'll show you how to inject into your butt. You might find it's helpful to have someone else administer the injection. But if you're planning to do it yourself, use a mirror so it's easier to see what's going on back there. To start, select a location that's within the upper, outer quadrant of either side of your butt. Keep track of which side you inject since you'll switch sides each day. And never inject into an area that's tender, red, bruised, or hard. Giving yourself a shot in the muscle can be a bit uncomfortable. So before you start, apply ice or a frozen bag of veggies for a few minutes to numb the area. When you're ready, use an alcohol wipe to clean the skin, about 2 inches around the injection area. Then give it a couple of seconds to dry. Now you're ready for the injection, so let's do it. Remove the needle cap and hold the syringe with one hand. Then use the thumb and index finger from your other hand to firmly stretch the skin around the injection area. Using a quick, dart-like motion, insert the entire needle straight into the skin at a 90-degree angle. Slowly push the plunger until you've injected all of the medication. Do a quick count of 1, 2, 3, and then remove the needle and press down firmly on the injection area with a gauze pad. Nice job! Now, your final step is cleanup. So toss the used syringe and needle into the sharps container. And if you have any leftover Menopur that's been mixed, go ahead and toss that too. Thanks so much for watching today. Take care.